One of the reasons that I did this piece of work was because there's a lot in the literature about the burden associated with being in hospital when you've got palliative care needs. So the environment is not considered to be an appropriate environment for people with palliative care needs. So the physical environment's difficult, people are really busy, people have unmet needs. There's lots and lots of evidence that the hospitals are not a great place to be. In my experience, having worked in hospital palliative care, I met patients and families time and time again where being in hospital was not such a bad place, and in many instances people didn't want to leave the hospital at the end of their life, and so I was curious about why that would be, and so I was really keen to explore with patients themselves what they thought the benefits of having been in hospital was. So I wanted to interview them, and I interviewed them at the time they came into hospital within 48 hours, and I interviewed them again a week later post their discharge at home, usually at home. And the benefits that they talked about were associated with feeling safe during a period of acute illness. So when they were unwell coming into hospital, they felt safe, and that was associated with being monitored and observed by experts, the doctors and the nurses who had that level of expertise around their illness. It was also associated with feeling better, so they all talked about feeling better compared to when they came into hospital, so getting better, feeling better. And also there was an association with their family, so a lot of these patients had family caregivers, and they felt that there was a relief for family that they were finally in hospital. And it wasn't a relief from caregiving, it was a relief more associated with the responsibility of deciding what level of care these patients needed. And so you can imagine they're getting sick at home, things are changing, and the family are thinking, should I ring the doctor, should I ring an ambulance, should I get them to hospital? And there was a sense of relief when they finally went to hospital that they were getting the treatment or the care that they needed. So I thought that was quite interesting, because I assumed it would be about respite from caregiving, but it wasn't that at all. And then the fourth benefit that came through was really around accessing support in the hospital to make their care at home easier. And that was things like the practical things like getting equipment or referrals to community providers like the hospice, but also things like having access to a dietitian and a physiotherapist, learning about how to look after themselves at home, so having adequate nutrition, being able to mobilise in a way that kept them as active as possible, things like that. So yeah, so there was a lot of benefit having been in hospital. Well, I suppose the thing that I wanted to do was highlight the fact that the hospital has a role in palliative care, and rather than us trying to disassociate the acute hospital with that model of palliative care, that we need to understand how it fits into the community provision of palliative care as well. So palliative care is very community orientated, the whole philosophy of palliative care is very community orientated, and I want to sort of balance the argument that the hospital does have a role and that the admissions do have some value to patients and families. That isn't just about treatment. So that was the other thing that surprised me about my results, is that the benefits patients described it was beyond just treatment and investigations, and I thought, as a healthcare provider, I thought that was the things that they couldn't clearly get at home, but it was something much bigger than that. Yeah. So the further research really is around understanding the bigger picture of hospitals in the more integrated model of palliative care. Where does it fit alongside hospice, home, aged care providers who are providing a big part of palliative care as well? Where does the hospital fit in that?